So what have been the missteps? If I look at the political side, I think the politicians, I was counting, there are almost 30 countries which have had elections since last year. And giving the time dimension, I think having an election last year in the midst of the global panic and how everybody was behaving, that was really bold, or maybe not so bold, maybe foolish to a certain extent. But countries went ahead and they held elections as usual. I think what has been disappointing maybe about some of the African leadership is the business as usual approach. So when it comes to let's have elections, it's the same elections. We can have huge campaigns, we can have rallies, we can have people, shouting and dancing, in spite of everything we know about how COVID is transmitted. And so countries have successfully managed to grossly undermine their public health messaging by insisting on the business as usual approach to political, politicking and political campaigns. That's one thing. The second thing, when we look at the global dynamics, Gitingi has shown us the where we are, for instance, in the vaccine access race. We are somewhere very far. It's like we are warming up for a marathon, and most of us are still warming up. This was not the first thing. The first thing was testing, where African countries had all these plans to test people, and very soon they knew that the testing supplies were not coming. So they had to completely change the testing strategy. Many African countries do what is known as targeted testing, where you test people who have symptoms, contacts, and people traveling. But that wasn't the ideal. But when the testing materials were not coming, they decided to shift. But that was the first sign. And this is being pushed up to what we are seeing in the vaccine. So what has been the business as usual is the failure of the African political leadership to recognize that this is a very unequal global system. And it's like they're snapping out of it slowly by slowly. You see more and more African presidents being outspoken. But for many months, they were still trying to shame people who are shameless into giving us vaccines, and thinking that trying to shame people somehow is going to break down all these structural, global, broken system of what we call global health, but which seems to be something else than global health. So I think that's what has been surprising, that the African leadership has not woken up to the fact that I think the value attached to African life in the global system is low, and maybe that should be the thing that brings us together around solidarity for Africans and around Africa itself. So I think those are some of the missteps. And then what I mentioned earlier, the sort of medicalization of the pandemic from in the initial phases, where everything was about the health, but not what about the education, what about the environment, what about the economy, what about agriculture? So there was still it is something which has been there, that public health tends to be medicalized, and we've not yet come up with good approaches of how you bring everything together. Because for the person on the street, it's not just about COVID. It's about their next meal, it's about their job, it's about their church, it's about their kid who's going to school, their grandchild. But then for us, we want them to be obsessed with COVID and forget everything else. So the failure of multisectoralism, I think, is one other thing. And I don't see movements towards let's learn. This is like a once in a lifetime opportunity, that let's learn about how to do things differently, so that we always don't see things from a medical or a health perspective, that we see the broader environment in which each of us exist.